Everyone. My name is Benjamin Day,
I'm Stephanie Nakajima.
and this is Medicare for All, the podcast for everybody who needs healthcare. That's my pre-vacation announcement, which comes delivered with a little bit more energy than usual. I'm getting out of here on Wednesday.
I've never seen Ben like this before in our 5 years of working together.
So, what should we talk about, Stephanie?
So today, good insurance news. United Healthcare, the largest insurer in the United States, announced this May an evil new policy it said would help hold down healthcare costs. So how this works is the insurer would review claims after the fact, right, for emergency department care to determine whether or not the visit that you had at the ER was for an actual emergency. And if it was not, as deemed by this insurer, who has every incentive not to pay your bills, the insurer would deny the claim. Mm-hmm. So after an outcry from doctors and patients, understandably, United Healthcare said it would delay implementation until at least after the pandemic had passed.
So nice of them.
They softened.
Hearts of gold.
But it's still, the insurer still plans to institute the policy eventually. So like almost everything in our healthcare system, this new ER policy, it doesn't make any sense, even on a financial level, and of course not on a moral level. Ben,
yeah,
your thoughts?
Well, I mean, the theme here is, of course, since our healthcare system cannot control costs, premiums would tend to rise more and more and more. So insurers, their whole job is to try and find ways to make our healthcare coverage worse, to prevent those premiums from going up more. So this is just one of the many, many myriad ways that they're screwing us over. And this resonates with me more than most, because although I didn't have the experience of going to emergency room and then retroactively after the fact having my stay there not covered, I did have the experience of being admitted to a hospital for a few days and having that stay denied by my insurance company, which was Aetna, another lovely national for-profit insurance company. And I can tell you the experience, just how shocking and demoralizing and like kind of end of your life experience that is. For me, I was suffering from panic attacks. I had a panic disorder. At the time, I actually didn't know that it was panic attacks. I thought I had some terrible like physical illness. And my doctors actually misdiagnosed me for like a month, but I kept landing in the emergency room over and over again. And so eventually I was admitted to the hospital for a few days. And when I was being discharged, my doctor sat me down and said, we don't want you to panic. But your insurance company said they're not going to cover your stay here because they thought you should not have been admitted to the hospital in the first place. And it's like, what the fuck? I was just listening to my doctor's recommendations, basically. And of course, I didn't know. I just had these terrifying symptoms that were preventing me from working anymore, from going to school, kind of functioning in day-to-day life. So you kind of put yourself into the care of the healthcare system. And then you end up with this bill, $4,000 or $5,000, which to me, I was earning like $14,000 a year. It might as well have been $4 million for me. I was starting to figure out, like, am I going to have to file bankruptcy myself? I was really young at the time. Like, could I possibly fundraise this much money for my family, which I wasn't sure I could. And, I thought I had done like everything right, so to speak. Like I had a job that had private health insurance. I thought I was covered. And I guess I was naive. I was pretty skeptical about all things American healthcare, but I had no idea you could literally be covered and follow your doctor's orders, like do everything right to a T. And then your insurance company can just decide that they're not going to pay for you and you'll be stuck with this massive bill. And this is basically what we're talking about in the context of the emergency room, which is usually the moment when patients have the least control or ability to make, rational decisions. You can't shop for providers at that point. Usually you just need care right then. Stephanie, this is maybe the dumbest question I'm ever going to ask you, but why is United Health now implementing this whole policy of actually screwing people over who go to the emergency room, which, many of us have had experiences with denials, but usually the rules have been a little bit stricter for emergency rooms?
Right. Well, they haven't actually come out and said this, but as you may have heard, ER visits have actually been down during the pandemic as people are afraid to go to the hospital and
Right.
catch COVID, and are even being instructed to stay away from the hospital if they have some serious illness. My father-in-law, who was dying of COPD, complications from COPD in Denmark, they really tried to keep him out of the hospital, especially in the beginning of the pandemic, as long as they could, while they were still trying to figure out what was going on. But anyway, so ER visits are down, which means private health insurance profits are up. And United Healthcare is absolutely no exception. It reported more than 15 billion in profit last year, and to put that in context, that's an 11% increase on the profit it made from the previous year. And so, I think that they looked at this and they said, this is amazing. Let's never have people in the ER again.
I mean, that number, the 15, that would cover like a percentage of the Medicare expansion we've been talking about, right? Like extending dental, vision, and hearing to all seniors. You could almost do that with just the profits that they're skimming off of our healthcare system.
It's so infuriating
in
that
1/4.
Yeah, I mean, with all the pay-go rules and everything trying to scrimp together, how are we going to cut costs so that we can finance like dental or vision or something like that? And then just because they are still allowed to collect all of our healthcare money and not have to give it back to us in any way. I mean, it's just unbelievable. Yeah.
So a good time for them to start skimping on coverage.
Exactly.
More, right? Yeah.
And they've never really wanted people in the ER, and they've been doing this for a long time, which we'll get into later. But Ben, could you tell us a little bit about Anthem Blue Cross? And I think that they've been doing this for a while.
Yeah. So I don't wish this is the first time this is happening, but we're kind of reliving history a little bit here. Anthem Blue Cross, which some people hear Blue Cross and they think it's a not-for-profit organization, but a lot of the nonprofit Blue Cross insurance companies around the country have converted to for-profit. And so that's the Anthem Blue Cross. That's the for-profit version of Blue Cross. So they started doing this back in 2015. I think they started in Kentucky, and then they started gradually over the years spreading this policy out from state to state. And looks a little bit different in each state, but they basically were doing the exact same thing. They're saying, we're going to review all these emergency department visits, decide retroactively after the fact that some of them were not necessary, that they weren't actually emergencies. And in those cases, we are going to refuse to cover it. And the entire hospital bill then goes to the patient who landed in the emergency room. I actually pulled up, this is the letter that Anthem sent to their enrollees back in 2017. I don't know this is Missouri, actually. And like typical, like this is Orwellian, like newspeak. In big bold letters, the title says, "Save the ER for emergencies, or you'll be responsible for the cost. Going to the emergency room or calling 911 is always the way to go when it's an emergency. And we've got you covered for those situations. But starting June 1st, 2017, you'll be responsible for ER costs when it's not an emergency." Quotations mark, this isn't a change to your benefits plan. If you need care now, but it's not an emergency, try these other options. Urgent care, retail health clinic. We all know going to CVS is a great option when you have when you're in serious pain. Live health online or 24/7 nurse line. Basically, 3 of these 4 are not care at all. So we've seen this, and as Anthem has continued, Anthem's policy is still in place. They've expanded it from state to state. They're not quite as big as United Health, which is why it's terrifying that United Health is now implementing a policy just like this. But yeah, we've started to see this, and I believe also even in Medicaid, some states have implemented policies like this as well.
Yeah. So many states have actually been implementing this policy for Medicaid beneficiaries for years, sort of like a sandbox for what was to come for the private sector. And this is just a pattern of targeting and terrorizing Medicaid beneficiaries, part of, for example, a pattern of work requirements and cutting benefits of all kind and privatizing Medicaid as well. So basically what what happens here is that these Medicaid programs have implemented copays for non-emergency visits. So, Ben, what do you think would happen to ER visits in a situation in which, you know, your insurer had implemented copays for a visit they would later deem to be emergency?
Well, it says copay, so I assume it's something like, I'm going to hope that Medicaid is not as evil as these big private insurance companies. Maybe this is wishful thinking, and you'd be paying when I go to the emergency room, I pay a copay of whatever, $100 or $200. It might be even up to more than that now. But is that more or less what these Medicaid programs are doing, or?
Yeah. So basically, these copays, the implementation of these copays has had zero impact on the number of ER visits by Medicaid recipients.
So that was knocked it out of the park with that policy, right?
It's just a way of, because of course people still need to get care, and this is the avenue in which they need to receive it, then they will continue to get the care there. And it's just really a way of extorting more money out of people who are on Medicaid for the reason that they don't have money, right, to pay for healthcare.
And there's a long history of kind of basically essentially trying to punish and torture people who are in public welfare programs like Medicaid to allegedly want people not to go onto those programs and, get back to work in the private sector, even though there's a pandemic and, vast, regular unemployment levels that the government actually maintains intentionally. So I see this kind of as a piece of that as well.
And there's actually another piece to this, which is that most states, including Florida, will now charge you a percentage of the bill if that visit is deemed to be a non-emergency. Mm-hmm. So if you're on Medicaid and you get charged a percentage of a hospital bill, I mean, that could be devastating, right?
Yeah, and this is co-insurance, which is like I said at the beginning that insurance companies keep like coming up with new ways to make our coverage terrible. I feel like no one even knew about co-insurance. Like, I don't know, 5-10 years ago, it just wasn't a thing, and now it's just like taking off everywhere. And now it's part of our Medicaid plans in some of these red states. But
yeah, and I think there's one state, South Dakota, that goes so far as to charge you the full amount for a non-emergency,
wow.
right? ER visit. So just like Anthem and United Health are doing with their private plans.
And I mean, there's a reason that Medicaid historically has not had, allowed copays or large deductibles or anything. It's because by definition, only very, very low income people qualify for Medicaid. I know that South Dakota has not expanded Medicaid yet. So that means you probably have to be below the poverty line to qualify for Medicaid. And if you then end up with an emergency room visit that the South Dakota Medicaid then decides was not emergency, and then you get stuck with the whole bill, I mean, it's almost a guaranteed bankruptcy. I mean, there's no way if you have that little income that you can afford any emergency room visit, no matter how brief. You know how crazy these bills looked, even when you get like nominal care or someone barely does anything to help you once you're in there. So
yeah, this is one of the things we don't really talk about in the single payer movement, that just having inequality of insurance is in itself really wrong. And it's something I think that really, takes the legs out of the idea that we can get universal coverage through a mix of public and private, right? I mean, Medicaid is life-saving for people, but it's still like not that great of insurance. It's usually has a very restricted network. I mean, you're less likely to find a PCP who will take Medicaid. Medicaid is one of, isn't actually, I think it's only 65% of PCPs will take Medicaid. And so on top of that, then if you get these kinds of additional copays or co-insurance, just like with private insurance, then you're getting both a restricted network and in many cases, not as comprehensive coverage as you should be getting for your income level.
Right. Well, we have a long, really positive history of separate but equal public services. So I'm sure that this will work out, this public-private mix idea. So what I wanted to talk about a little bit was, for my experience with getting one of these big hospital bills, the notion that I, as a patient, could like figure out whether I was having an emergency or not is kind of comical. I mean, or whether I should have been admitted to the hospital or not. I literally did not know it was happening to me. I didn't know if it was a mental health issue. I didn't know if it was a physical health issue, and my doctors didn't either. It took them a while to figure it out. So I went back and looked at the one thing about the fact that Anthem has had this policy in place now for 5 or 6 years is that there actually has been a lot of research out there, kind of following up what has happened with all these Anthem patients who have now had their coverage denied. And one thing, I pulled up a report. Senator Claire McCaskill of Missouri actually issued their office issued a report about how dangerous and harmful this Anthem policy has been in Missouri. And her report found in Missouri that 73% of these denials that Anthem made, saying we're not going to cover your ER stay, were overturned on appeal. So, of course, this is only people who know that they are able to appeal, that have the time and resources to go through a whole appeals process. These were back in the sort of the Clinton era that we passed all these patient bills of rights to protect people from managed care, which was denying healthcare coverage left and right, just like this, but with other types of care. And so most of that created these state-run appeal boards where if your insurance company continues denying your care and you think it's wrongful, you can appeal it up to a state board level. So that's what we're talking about here. So almost all of them get overturned. And that means that for almost all these denials, they were actually wrong, that these were not emergency visits. And that these people should not have entered the emergency. And the report says that the numbers were very similar in neighboring states like Kentucky and Georgia, also up in the 70s and 80s, of all of these getting overturned. So it's complete bullshit what they claim, that that they're trying to prevent unnecessary use of emergency room and provide cheaper care to people in different settings. And there's also a big 2018 study that was published by Boston area researchers. Shout out to Boston area people. And they basically looked at, what would happen if this Anthem policy was spread to the rest of the country, which, terrifying as it sounds, that to me is what is actually happening when we look at this, when we look at it trickling out to Medicaid policies. When we look at United Health announcing this major policy change, it is starting to happen. This is going to be like the new norm that all of us considered unthinkable 5 years ago, and 10, 15 years ago, we're all going to be like, oh yeah, ER denials. That's going to be another thing like surprise billing, And, what their study said was that basically the idea that you can, after the fact, retroactively review and deny emergency room visits is itself basically impossible and immoral. And what they said, I'll just quote them briefly here, is, the main limitation of retrospectively judging the necessity of ED care is that the determination is based on information not available to patients prior to the medical evaluations. When patients become acutely ill, they must decide whether to seek care, and if so, when and where, based not on a diagnosis, but on the symptoms they are experiencing. So, if you have chest pain or a very severe headache, you don't know if it's a heart attack or if it's, if you're having, heartburn. If you have a severe headache, you don't know if it's brain cancer or a migraine maybe that you've never experienced before. So the whole notion that you can kind of before the fact determine whether you are worthy of emergency care is kind of a joke. And to use the diagnosis that comes out at the end is unfair to patients who have to make the decision in advance about, should I go to the emergency room where I might possibly get billed or not? So, Stephanie, I know that along with like this research and data analysis, there's also been like all these horrifying stories that have come out since Anthem started doing this.
Yeah, I mean, and just to cap off kind of what you were saying there, that's the evil genius, I think, of this policy, is that it combines two goals of the private health insurance industry, one of which is continuing terrorization of and conditioning of people to be afraid to use their health insurance, right? They want you to be conditioned early on to think twice about, whether or not you really need to go to the doctor or whatever, because the more times they push back on you, the more times they deny you care, the more of a hassle the experience of going to the doctor to be, and the less likely you are to go in the future, which is going to help them keep costs down. And then the second insidious thing I think about it is just that it's another effort to reframe managing your health insurance, which nobody should be doing. That's a function of the state, really. Managing your health insurance as a personal responsibility, right? You can do your homework about knowing which doctor or hospital is in your network. You can read your plan and know all the minutia before you request a treatment. Jump through all their hoops. It's part of like a victim blaming effort to cast.
And we know in reality what that looks like, right? We all Google our symptoms. And then it's no wonder everyone lands at the emergency room. I don't know about you, but every time I Google my symptoms, I'm like, oh my God, I have dengue fever. How did I get dengue fever in Boston, Massachusetts, in the regional Northeast? I mean, the notion that this should be the responsibility of patients to decide whether they're having an emergency symptom or not is so wrong on so many levels. I mean, we are only able, I think, to diagnose our panic level, not our, not provide an actual medical diagnosis. And even medical professionals are not supposed to diagnose themselves in circumstances like this.
Yeah. And I mean, the hell that it is to get to the doctor in the first place. I mean, that itself is a big enough barrier, I think, that anybody who didn't really need to go would not go.
And then just the ER copayments, even if your whole visit isn't denied. I mean, the ER itself is very expensive to use. So no one does it lightly, I don't think.
Yeah, exactly. And it's just super dangerous for patients to erect a barrier like this. It's not just, inequitable, because it's obviously inequitable and all that stuff, but it's actually dangerous, right? And then I think the other thing that I would really want to point out here is that there's actually disproportionate impact on people of color, and particularly women of color. So according to the Journal of Public Health and Emergency, women use the emergency department 25% more often than men. Men aren't in touch with their bodies. They're not going to the ER when they need to, whatever. And Black Americans under the age of 65 use the emergency department 10 to 20% more often than white Americans. So this is a policy to keep, people of color out of the emergency room, basically.
Right. Yeah. Anyone who uses more healthcare, basically, as a group. And we'll get to this later, but, obviously a lot of people have this image that uninsured people are like using the emergency department as their primary care. This is actually not true. And the main reason people use the emergency room when maybe they don't have to is that they don't have access to primary care at those times. Maybe it's on the weekend, maybe it's on the evening. Before this call, you and I were talking about like, how do we even find urgent care within our insurance network? And it basically doesn't exist anywhere in the Boston area. There is no urgent care. So it's like, if your primary care doctor's office is not open, the ER is your only other option if you're experiencing pain that you can't put up, withstand for however much longer you think it's going to take to get, access to primary care. So.
Yeah. And if you think that, this conflation of symptoms that are real versus symptoms that are more mild is something that's made up. So listen to the story from this student in Florida. She was a nursing student, actually. In 2017, she went to the emergency room in the middle of the COVID pandemic. So wait, this was not in 2017. Sorry. She experienced severe chest pain, numbness in her left arm and leg, and shortness of breath. And she feared she was having a stroke or heart attack. And an ER doctor evaluated her and determined she was having a panic attack. Sounds a little familiar.
Yep.
But of the $16,000 she was billed in ER charges, ouch, the insurer would only cover $292 because, according to her explanation of benefits documents, the charges exceeded the maximum allowed. And she was able to read her plan and be like, that's actually not what it says. And when she pushed back on that, they responded that actually United Healthcare advised this diagnosis does not fall within the definition of an emergency.
That is so similar to my story, except, the amazing thing is that the bill is so much higher than what I got. And I was admitted to the hospital for 3 days. I didn't just go to the ER. And I mean, everybody knows who has anything to do with panic disorders that panic attacks for many people feel almost exactly like a heart attack, and people think they're having heart attacks when they experience them. So again, this is just like, if you're a patient, how can you possibly know, especially if it's the first time, whether what you're experiencing is a panic attack, which actually to me is an emergency, or a heart attack or a stroke, which is obviously a much more dangerous emergency. But you can't diagnose yourself until you've actually been brought into the hospital itself, and that's exactly, they were doing the right thing, I think, there.
Yeah. Well, the moral of the story is, if you have severe chest pain, make sure it's a stroke or heart attack before you go to the ER,
Right.
and not just a panic attack.
Maybe we all need to like have machines at home so we can take our own vitals, and that would help us determine whether we are actually having an emergency or not.
I'm sure that would bring the cost of healthcare down.
Exactly. It would at least bring the insurance company's cost down and help out with those struggling profit lines there. I saw this second story. This is from a Jacobin article. That last year, California healthcare regulators fined health insurer Aetna, my arch nemesis Aetna, for wrongfully denying members emergency room claims 93% of the time, in violation of state laws protecting emergency room patients. The department's sample of ER claims denied by Aetna in 2019 found that a stunning 93% were wrongly denied. And I imagine if we were to review all of these denials in any other state from any other insurer, we would find about the same thing. Because, you saw 73% of patient appeals were overturned. And that doesn't include the patients who didn't bother to appeal because they didn't know they could or didn't have time and resources.
They're just doing like an automatic denial.
Exactly.
Just to see if you're going to fight it, just to see what they can get away with. I mean,
they know a percentage, and that's all this is. This is all United Health is doing. This is all that Anthem is doing. They're extending this thing, which they already do in a lot of other areas of our care, to the emergency room for a certain category and a certain way that they think they can get away with it. And they know a certain percentage of people will let it slide and end up with a bill, and either will pay it on their own or will end up in collections, and that bill will not have to be handled by the insurance company, which helps their bottom line. So
yeah, and not only that, but like our premiums are going to pay for the processing of all of these denials that they're doing because they can.
Exactly. Yeah. And that's where all the administrative waste in our system goes to. Yeah. So you raised the question of, one question is this even a rational policy for patients to be able to choose whether, do I need emergency care right now or do I not? But what about this claim that they are trying to bring down healthcare costs by, they're claiming that people are unnecessarily using the emergency room when they could be treated by a doctor or an urgent care facility, so that they're just, trying to incentivize people to go to the right place for the type of care that they need, and that will be cheaper because it costs less to treat people in these other settings than it does in the emergency room. Is even that true? Or
yeah, I guess we don't actually, there's no evidence to show that that's actually true. So the number I've seen again and again that's been invoked here to justify this policy is that this unnecessary use of emergency room costs $32 billion annually and drives up healthcare costs for everyone. It's going up and up and up. When actually ER visits have been stable for years. They're not going up and up, but the cost to run the ER has been going up, and that's driven by prices, which of course is something that, a single payer healthcare system would fix for us, right? By not allowing providers to just continue charging whatever and whatever, right? And so what ends up happening is that patients land right in the middle of this fight that should be between providers and insurance. And so, this is a price problem, and we're just sort of tweaking around the edges and trying to bring down patient utilization, meaning trying to bring down actual patient care, because it's too hard to fix the prices. Because, well, that's what, they would say, is that it's hard to rein in industry greed, basically. So that's one of the things that I think is important to know, is that it's not there actually hasn't been an increase in utilization, but there's actually going to be a decrease in utilization as patients get thrown under the bus for higher prices.
Right.
And people, there's this argument that people use the ER like a doctor's office. Well, again, we talked about many people don't know if their symptoms are true emergencies or not. So whatever you come out on the other side with, maybe that could have been dealt with at the doctor's office, but who is to know until you get there, right? And in 2017, there was this really interesting study that sort of casts doubt on whether or not like reduction in ER would do anything to this problem, right? So basically, this study, it sought to encourage uninsured Virginians to visit a primary care physician instead of the ER with some kind of financial incentive. So they give them money to go, to a primary care physician.
Like a positive financial incentive, not a horrible punitive negative
Yes.
incentive. Well, that's an improvement at least.
Getting close to giving them like their right to healthcare, right? And they found that there was a modest reduction in non-urgent visits to the emergency department with such patients. So it did work to reduce the number of visits to the emergency room, but the total costs for the whole hospital system did not decline because the savings from avoiding the emergency department was offset by increased utilization in the outpatient sector, right? Because people are going to the doctor because they need care. They're not going for any other reason besides that they need care. And that's the final thing that I think just bothers me about the whole framing of why are people using the ER like a doctor's office, right? Where the problem that has been identified here is that there's like red on a spreadsheet, that is not profitable. And it's not the problem that should be identified, of course, is that people don't have access to healthcare. And I think that that's just how, the logic of capitalism naturally generates this disdain for underserved people.
Yeah, there's a Health Affairs article that the title is pretty succinct. The uninsured do not use the emergency room. They use other care less. So I hope people can get rid of this myth that everyone repeats. I think even on the left and even in progressive kind of Medicare for all circles, people seem to assume that it is the case that uninsured people are just like using the emergency department as their primary care office, which is not true. They use the emergency care the same as everyone else who has insurance. And the only reason we have this issue, we do have an issue of overuse of the ER, but it's because our primary care access is so shitty in the United States, which is not the case in many other countries, where they still have, doctors who do house visits. I mean, that's like if you watch like these old 1950s TV shows, it's like doctors doing house visits, quaint, neighborhood physician. But why are we not doing that anymore? I mean, that would be the perfect solution if you want people not to use the emergency room, if they have an issue where you don't know if it's maybe they need the ER or not, but they're in pain and they can't wait a full day, to have a doctor come and just kind of visit and do some triage in the households and provide some immediate help if it's not serious, but then send them towards the ER if they really, really need it. So yeah, this is infuriating. I wish we could do more podcasts on non-infuriating topics. I was actually enjoying the Medicare expansion fight stuff, since it feels like we're going to have some wins here, really expanding public access, really helping people's lives. But at the same time that we're like working at making some improvements in the public side, the private side is just completely going to shit, getting worse and worse and worse, and increasing, as you say, this kind of reign of terror, trying to keep patients afraid from actually going to seek care out. And this is just another piece of that. So,
well, all the reason to expand and improve Medicare for all.
Yeah.
Sooner than later.
And I was going to go off on a rant here about Hospital Corporation of America, which, the biggest national for-profit hospital chain, who had kind of a parallel strategy of historically emergency rooms lose money within the hospital systems because they have to be open all the time. They have to be kind of fully staffed up. And they have to accept everyone unless you turn them away. And tend to have a lot of more uninsured and people with Medicaid coverage, which doesn't pay as well. So it's not as financially lucrative, the emergency room. So Hospital Corporation of America, part of their evil plot to become a incredibly large, profitable national corporation was to make the ER profitable. And they did it a bunch of different ways. Some of them involved like massively overbilling Medicare and what's called upcoding, where someone comes in for a less expensive thing, but you code them as being treated for something more expensive. But the third thing they did was to start turning people away from the emergency room if they had a condition which they claimed was non-emergency, but in reality, it just doesn't reimburse well. Insurance companies don't pay them as much for treating it. So they started turning people away, and that helped them actually have shorter wait times in the emergency room waiting room. So once they had done that, they started putting on these electronic billboards in the highway, advertising their emergency room, saying, "Here's how short our wait time is," like a real time, wait time. So they've been driving people to the emergency room, but they, very similar to insurance companies, instead of after the fact, after you've already been treated in an ER, denying coverage, they have been doing this parallel strategy of turning people away from ER visits. And this is where our friend Amy Villela from Nevada, her daughter was turned away from an HCA hospital, claiming she didn't need emergency care. It wasn't urgent. She should go out and get insurance and seek a doctor. And then she had a blood clot break off in her leg while she was flying, and she died when she landed. So this is like the real life results of like real profit mongering in the healthcare system. And we've been seeing it on the hospital side a little bit longer than we've been seeing it on the insurance side. But it's really just dismaying, and it's another thing we're going to have to fight, I guess. So,
yeah, it's one thing I think it's bad enough really to saddle people with incredible debt after they've gone to the emergency room for something that isn't deemed an emergency, and another whole level of cruelty to deny them care in the first place, and cause people's death. Mm-hmm. I mean, nothing short of that, really. Mm-hmm. So awful.
Yeah. So we're going to keep. We're obviously going to keep you informed about like these trends and changes happening in the private insurance industry and all the horrible new shit they're pulling out, even as they're cashing in off of the pandemic. But I want to end by a couple of thank yous. First of all, shout out to the dude who every time we do a podcast posts like fake anti-vaccine myths on our Facebook page, and I have to delete it every time.
I just blocked him.
Okay, I did too. So he's been double blocked. Sorry, buddy, you won't be able to do this again. And then more important, sincere shout out and thank you to our podcast team who makes this podcast happen every single month. Our podcast manager is Sarah Sang. Our show notes writer is Jerry Katz. And the audio editor for this episode is Zandra Felicia. So thanks so much, y'all. And we will be back next time after my vacation.
Ooh.